Hi, I'm Pablo Timashuk from StopHeadachesNaturally.com. I'm going to be showing today some techniques for the suboccipital area using a great product by Premax. I've already warmed up this area before, but I'll apply a little bit more because I haven't gone into the area. But the technique right now for suboccipital is more of a sort of a trigger point work. In the previous videos you would have seen me really do some work while Liz was lying on her stomach, lying prone. So with both hands I can actually work both sides at the same time, so I'm really lifting up through that laminar groove right up to the base of the skull, working right up. You okay, Liz?
Yes.
So lifting it up, and then once you get right to the base, then I'm going to be bringing my fingers up right to the base of the skull there, and that's where the suboccipitals, that's where they sort of live, right through there. Okay, so I'm grabbing my fingers and just sort of dragging it in towards the bottom of the skull there, okay? So you do that a few times, and what I'm doing now is just gently creating a bit of sort of posterior anterior movement upwards. Be very mindful of that, don't be too aggressive, but you want to create a bit of joint play, get a bit of movement in that area. So once you're there, a lot of people wait until the patient relaxes into that position. What I do, I normally get the patient to take a big breath, and as you breathe out, just let your head fall into my fingers. There we go. Did you see Liz's head just relax? And you hold it there for about 5-10 seconds. Don't rush that. Any referral there, Liz?
No.
Okay, sometimes you can get a very strong referral to the top of the head, and I would do that. Another big breath, Liz. That's great. And as you release it, there we go. I just gently lift it up. Every single time Liz breathes out, I just go a little bit further. Great release for suboccipitals. Excellent release. And I'll continue doing that and then focusing on both sides. And then I will just, again, just finish off with a bit of that drag, a bit of that decompression of the spine. Don't be too aggressive with that, but just, lifting your hands and bring it towards you. Excellent technique. Excellent. And you can grab your head and just gently lift up and down a few times. Very important just to get the whole head to relax and move. And I'll tie up with all those different techniques. I'll always I'll finish off a treatment with some trapezius stretching. So bring the Liz's head to the side. I've got that locked in here. I bring my other arm to this, or hand onto the shoulder, and I get Liz to push her head against my hand on my forearm, and getting her to release. Great. And an alternative is to take a big breath, Liz. Hold that breath and then push your head as you take that breath. Great. And release both. There we go. And you just increase the stretch in trapezius. I'll do that for both sides. Bring it back nice and slowly. I could also do the same thing with a stretch for those posterior muscles. Bring your head to the forward, to her chest. Take a big breath. Hold that breath and push your head against my arms. Holding it, and release. And I just go a bit further every single time. And you do 3 or 4 cycles. Same thing, I'll just gently bring this head to the side, rotate it. I can bring my forearm, I'll grab my hand there, I'll lock my forearm, and just gently push your head against my arm, rotating it, Liz, against my arm. That's it. And you hold that gently and releasing, and you move it for me as far as you can go. Excellent. See that movement there? Excellent. And you do that 3 or 4 times until you release it. Very important to do some stretching afterwards. And another last one I would do would be levator scapula. Bringing up here, getting Liz to bring your head down towards your armpit. That's it. Now push your arm down against my arm, your head downwards. So pushing your head in this direction like that. Okay, so relaxing for me now. So if this is a very typical situation, they go, what's going on? Just instruct your patient, work through it. So now push down as I showed you, that's it, great. Holding it, and release. And just gently moving. And one more time, push, that's it, you got it. And release, perfect. Great stretch for levator scapula. Nice and slowly, always making sure we're supporting the head, and we finish off with some great stretches with all those different trigger point techniques. I hope that's helped, and if you want some more information, please go read my book on stopping headaches with some natural alternatives for pain relief. I could not speak more highly about Premax. It's a great product, and I look forward to hearing all your success stories. Thank you.
Hi, my name is Shama Kern. I have been practicing and teaching Thai massage for over 10 years. And today I want to show you the difference between Swedish massage and Thai massage. Swedish massage is mostly a Western modality, and Thai massage is an Eastern modality, although it originally comes from India, not from Thailand. Swedish massage is done with oil directly on the skin, and you have to be undressed, whereas Thai massage is done fully dressed, just like you see here. No oil is used, and it can be done on the floor, and it mostly is done on the floor, whereas Swedish massage is mostly done on a massage table. The workspace of Swedish massage has to be very private because you're undressed. Thai massage can be done out in the open, and that's how it's done in Thailand. In most massage shops, you can see what is going on. And you can do it in your living room. You fold up a blanket, use a mat or on a soft carpet, and you can do Thai massage. The technique of Swedish massage is different because oil is used, so it's easy to have gliding, stroking movements on the skin and kneading. Now, you cannot do that in Thai massage because you have your clothes on. So instead of these stroking movements, Thai massage uses pressure like this. And of course, Thai massage is famous for stretches. Hip stretch like this, or a hamstring stretch like that, or a back twist like this, rocking applications, hip rocks. So many different techniques in Thai massage. The tools of Swedish massage are mostly your hands and to some degree forearms and elbows. Those tools are used in Thai massage also, but on top of that, you can use your knees and your feet. Now that sounds drastic, but I'll give you a good example when that would be used. Let's say the massage therapist weighs 100 pounds and is working on a 200-pound man, and turn over please, and is trying to do a back massage with her thumbs. Now that wouldn't work very well like this. Imagine she weighs 100 pounds and her client is a gorilla. So in that case, you can use techniques like this with your elbows or your knees. Works great on big backs, or even your heels. This is a heel rock on the lower back. So the opposite example would be if the therapist weighs 200 pounds and the client weighs 100 pounds. In that case, obviously you wouldn't want to use elbows and knees and feet. It would just be overkill. So the tools in Thai massage are really, there's a lot of variety of things you can do, and it takes some time to learn. The philosophy of Swedish massage is based on the Western anatomical model, bones, anatomy, muscles, joints, whereas the philosophy of Thai massage is based on the Eastern model, which says there are energy lines throughout the body, and you can affect those energy lines by working on them. You can change the energy flow, you can improve it, you can free up the energy flow. Now, the positions in Swedish massage are basically just two, face down, face up. In Thai massage, you have those two positions, but on top of that, you also use side position and sitting position. Lie on your side, please. I will show you a stretch in the side position. Okay, side stretch in Thai massage. if you do Swedish massage and you're in basically reasonable shape, you don't have any major problems with your feet or with your back, you can do that. In Thai massage, it's a little bit different. You have to be in pretty good shape, lie face down, because you really have to move around. You have to be able to be on your knees like that. You have to be able to squat on your toes. You have to be able to sit on your heels. You have to move around the client, for example, like this. So ideally, Thai massage practitioners should do some yoga to be flexible enough to do this. So here you have some of the major differences between Swedish massage and Thai massage. I'll see you in another video. Bye.